As a GP, I've seen hundreds of women with menopausal symptoms, and a common theme has arisen. Unfortunately, too many people don't know enough about it, which means they've had to suffer with the effects for a long time before getting help. So in this video, I'll explain exactly what to look out for and what treatments exist. These are the topics that I'm going to cover in this video. I'm giving some general explanations here, so it's always best to discuss this with your own GP to get advice that is specific to you. Firstly, what do we mean by the menopause? Essentially, it's a collection of symptoms that occur because of a decline in the natural levels of the hormone estrogen. This also means that your ovaries will stop releasing eggs and you'll stop having a period. The technical definition of the menopause is when you've not had a period for over 2 years if you're under the age of 50, or if you've not had a period in over 1 year if you're over the age of 50. However, you can start getting symptoms even before this happens, and we call this stretch of time the perimenopause. So you can certainly start getting symptoms even though your periods are continuing as normal. Remember that all of this is a natural process, and about 8 in 10 women will unfortunately get some menopausal symptoms at some point. Unfortunately, about 25% of those women will have severe symptoms, and that's when it's even more important to speak to a doctor for advice. The duration of the menopause varies, and it's really hard to tell in any individual person, but for most women, it can last several years. Okay, so now let's talk about the symptoms that can occur. And there's no particular order to these symptoms. Some people will only get 1 or 2 of these, whereas others may well get all of them. So, with periods, as you start to go through the menopause, they will start to become irregular. Now, for some people, they'll be heavier than usual, but in others, they may be lighter. And each period may last longer than usual, or a bit less than usual. But over time, and this could be several months or even a couple of years, they will eventually start to occur less frequently and then stop altogether. Hot flushes are probably the most common symptom, and these can vary in severity, but it's often described as a sudden wave of feeling really hot and sweaty, and these can also occur at night, and some people describe them as drenching night sweats, such that they need to change their clothes. But it's not always that severe, and some people will have a much milder version of this. These can occur anywhere from a couple of times a week to several times per day. There can also be many different effects on the mood. It can make you feel down or depressed, meaning that you may lose interest in things that you used to enjoy. It can also make you feel anxious and worry about things that never used to bother you before. It can also make you feel irritable and angry, making you lose your temper more easily. Another symptom is affecting your sleep, making it difficult to fall asleep or making you wake up in the middle of the night, and this can then have a knock-on effect on making you feel tired or exhausted during the day. People often find that it's much harder to concentrate or even remember things, and this is often described as a brain fog, and it can be really challenging. I often see women who say that this has had a big effect on their confidence levels, and it makes them feel less comfortable doing things that they used to find easy and straightforward, whether at home or at work. Another effect is on the joints, because they can start to ache even though you haven't necessarily done anything to cause that, and that can put you off doing exercise or limit your mobility. Palpitations can also occur, and this is where you are more aware of your heartbeat than usual, and it can feel like it's beating more strongly or faster than usual. And it can also negatively affect your libido and cause dryness and discomfort down below, which can then make intercourse more painful. People often worry about the effect of all this on their relationship, so this can also then have an effect on your mood. If you think you might be going through the menopause, you might want to fill in this menopause rating scale questionnaire, where you can score the severity of your symptoms, and it can be really helpful to gauge where you're at, and then if you were to start treatment, we can see how this is progressing and hopefully improve it. So let's say that you have some of these symptoms and you're thinking that you might be going through the menopause. What's next? Do you need a test to confirm this? Well, not necessarily, because if you're over the age of 45 and have convincing symptoms of the menopause, a blood test isn't actually necessary to confirm the diagnosis. But if you are between the ages of 40 and 45, a blood test may be offered, because it will add some weight to the diagnosis, because it's not as common in this age group. In this case, you'll be offered a test called the FSH, which is a hormone that normally rises and falls during the monthly cycle. But as you go through the menopause, this level begins to rise and stay consistently high. If you're offered a blood test, we usually arrange 2 levels 6 weeks apart. This is because of the normal fluctuation of this level during the month, So if it is high on 2 occasions, it's more clear that you are going through the menopause. But if you're under the age of 40 and you have symptoms suggestive of the menopause, you may be offered additional tests, and that's because it's even less common below the age of 40, and we also need to consider the possibility of another cause, such as premature ovarian insufficiency. And this is a condition where the ovaries stop pumping out their normal hormones at a much earlier age than expected, and this usually requires discussion or referral to a hormone specialist. So, now that we're sure that you are experiencing symptoms relating to the menopause, what can we do about it? Firstly, let's cover non-hormonal treatments. Now, some people may try herbal treatments, and there's no shortage of products that claim to be a natural option for managing the menopause. And some of these may well help some people, but there isn't any convincing evidence to suggest that they will definitely help the majority of women. We also have to bear in mind that although they may well be natural, they still can have side effects of their own. And I would recommend this link by the British Menopause Society that goes through the evidence for these herbal options. Another option would be to take medications like antidepressants, and these can help with symptoms of low mood and anxiety, as well as helping with symptoms such as hot flushes and potentially sleep. Talking therapy such as cognitive behavioural therapy is another option, which can also help to improve the mood symptoms and even sleep. And those are the most common non-hormonal options. In my personal experience, I tend to find that many patients can find those helpful when they have relatively mild symptoms, but if their symptoms are more severe, they aren't always as effective. Now let's talk about hormone replacement therapy, which is a treatment that we have the benefit of decades of research about, so we understand the risks and benefits and side effects very well. And what we know is that most women with menopausal symptoms will benefit from taking HRT. Now when we say HRT, what we mean is the hormone estrogen, usually alongside the hormone progesterone as well. And the reason it can be so effective is because we're essentially topping up your hormone levels to what your body was used to. And there are estrogen receptors all over the body on different organs, which is why a lack of estrogen can cause such a variety of symptoms. The main benefit, therefore, is that it can improve every single one of the symptoms of the menopause, though the effect will vary from person to person. Some people find that it controls all of their symptoms and they go away entirely, but unfortunately, some won't have such a positive response. It can also have a number of other benefits, and there are studies which have found that it can reduce the risk of heart disease, strokes, bowel cancer, arthritis, and osteoporosis. So arguably there's lots of good reasons to be on HRT, even aside from treating the symptoms of the menopause. There are some risks to bear in mind though. Firstly, with certain types of HRT, there can be an increased risk of developing blood clots. So those types of HRT are not prescribed as commonly these days. Secondly, some studies have found that there can be an increased risk of heart disease for women who start HRT more than 10 years after the menopause. However, as I said earlier, before this age, it can actually reduce the risk of heart disease. Thirdly, it can increase the risk of certain cancers, such as cancer of the womb, ovaries, and breast. With cancer of the womb, the way this could theoretically happen is if we were to just give the hormone estrogen alone, this could increase the thickness of the lining of the womb, and that could potentially lead to those cells eventually becoming cancerous. For this reason, we give the other hormone, progesterone, which stops the lining of the womb from becoming too thick. And for this reason, if you've had a hysterectomy, you don't need the progesterone, but if you have a womb, then you will be offered this. In terms of ovarian cancer, there is also a slightly increased risk. And if we gave HRT to 1,000 women, we know that there would be one extra case of ovarian cancer. The other risk is with breast cancer. Now in the UK, all women have a background risk of developing breast cancer. So in the next 5 years, we know that about 23 women in 1,000 will get breast cancer regardless. By adding an HRT, we know an additional 4 women, so 27 in 1,000, would get breast cancer in the next 5 years. However, as you can see from this graphic, this risk is relatively similar to being on the combined contraceptive or smoking or drinking this amount of alcohol. And what's a much bigger risk is being overweight with a BMI over 30, which actually doubles the risk of breast cancer. So although it does increase the risk, it's not necessarily so bad, and there are many other common things that also increase the risk that maybe people didn't even realize. These are some of the possible side effects of HRT. As you can see, they're quite similar to the side effects that can occur with other hormones like contraception. So it can cause things like fluid retention, though not actually weight gain, bloating, breast tenderness, nausea, and headaches, for example. Periods may also change and are usually lighter, but can become irregular or heavier for some people. And although it tends to help with people's mood, it can also cause mood swings itself. Now, in terms of our options with HRT, remember that we usually give two hormones, estrogen and progesterone. Option 1 is that we give them both together, combined as a capsule that you take every single day. However, that is the one that can be associated with an increased risk of blood clots, so we don't always give that as commonly these days. The second option is that we still give both hormones together, but as a patch that goes on the skin. Now, the patches last for 3 or 4 days at a time, so we usually suggest changing them twice a week, for example, every Monday and Thursday, and we usually apply those to the buttocks or the thighs. They are waterproof, so you can go in the shower, you can also go swimming with them. The third option is that we split up the hormones. We give estrogen in one way, for example a patch, but this time it's an estrogen only patch, or it could be estrogen through the skin in another way, such as a gel or a spray that you rub into the skin, and those dry and dissolve within about 5 minutes. Separately to that, we may give the progesterone as either a capsule or as the Mirena coil, which goes inside the womb. Now, there are benefits and disadvantages to each of these options. So, for example, some people prefer to have the combined patch because it's all in one package, so it's easier to remember. On the other hand, some people prefer to split up the hormones, and there can be various reasons for this. For example, some people are not keen to be seen wearing a patch, so the gel or the spray may be a better option for them. It also means that with the gel and the spray, you can adjust the dose slightly yourself. In terms of the progesterones, there are some benefits. For example, being on the capsule version of the progesterone tends to help with sleep, so we usually say to take that at night. That capsule also has the lowest risk of breast cancer out of all of those HRT options, in that the studies have shown that there is no increased risk of breast cancer for the first 5 years of use. It then returns to that risk that we talked about earlier. On the other hand, some people prefer the Mirena coil because that can be put inside the womb and stay there for up to 5 years, so you don't have to worry about taking a tablet every day. The other benefit is that it also acts as a contraceptive. And that's an introduction to the menopause and HRT. If you would like to know more, I would strongly encourage you to speak to your own GP and come to a joint decision with them as to what might be the best option for you. Remember that everyone's treatment is slightly different, so there's no one-size-fits-all approach. But bear in mind that we do have some good options in terms of HRT, so I hope that you don't struggle on your own with these symptoms for too long. If you did enjoy this video, please make sure you hit the like and subscribe buttons. And if you want to watch more, you might be interested in this video, which talks about why GPs are so busy right now, or perhaps this video on how much junior doctors are paid. And I'll catch you next time. See ya!